My name is Angela and I cared for my parents in their own home for 10 years until they died. My mum had Alzheimer's and my dad had Parkinson's, which caused dementia as well. I felt it was a battle to keep them at home, always having to fight for all the supports that were needed. The system is failing our older people and COVID amplified that. When COVID hit, my mum was in end-stage Alzheimer's. She'd become non-verbal, incontinent and lost all mobility. We needed to use a hoist in order to care for her, and you need two people to use a hoist safely, so I was very dependent on the care assistant coming in. During COVID, my dad became unwell with what seemed like a cold. I rang the GP and we decided it was best to err on the side of caution and get Dad tested for COVID. We immediately informed the agency who provided the home care, and they told us that all care was now withdrawn. They said that once COVID was suspected, they had to withdraw care as instructed by the HSE. We had a lovely healthcare assistant who said she was happy to continue coming as she wasn't going into any other homes in the community, but she was told no, she was not allowed. I know it was a difficult time for everyone, but I think it was the coldness and the apathy that the agency displayed that got to me most. At that time, it was taking 10 days for COVID test results, and thankfully my dad tested negative. But for the rest of the time during COVID, I felt so much more added stress, as I knew that if my mum or my dad or if I got COVID, the care would likely be withdrawn, and how would I cope? It was like family carers and their loved ones did not exist during COVID. No PPE, not even on the radar when it came to priority vaccinations. All the talk and time invested into reopening pubs and restaurants, when essential services for disability, mental health and elder care stayed closed. Family carers save the state $20 billion a year, and I don't think people fully understand the intensity and the level of care that family carers provide. I didn't until my parents got sick. COVID was such a stressful time, but despite this, I knew we were really fortunate in comparison to others. Because of the lack of supports in the community, people and their families are left with no choice but to use nursing homes. It is heartbreaking for them. And then during COVID, they were denied access to their loved ones. A care partner system needs to be put in place. Each person should be able to have a nominated person who, even during outbreaks, would always be allowed to visit them in the nursing home or hospital setting. It's already in place in Northern Ireland and parts of Europe, but still there is nothing in place here for our loved ones. My parents died during COVID and I got to be by their side, and no one should ever be denied that.